Good morning, honorable members. Good morning to the support staff, the delegation from the department, as well as the Central Truck Authority members that are here. I think we can start because I see we are a quorum. Am I right, Marcia?
Good morning, Chairperson. Good morning, colleagues. Yes, Chairperson, we are quorum. We may proceed.
Thank you. Can you flag the agenda? Thank you, Marcia. I just want to welcome the DG and his delegation from the department, as well as the members from the CDA under the chairperson. You are welcome to the Select Committee on Social Services this morning. And a special welcome to the honorable members and the support staff. Honorable members, we can see the agenda is in front of us. Can I get a mover for the adoption of the agenda? Well, Adrianse, you are quick this morning.
Always, Honourable Chairperson. Good morning, everyone. I move to adopt the agenda as is. Thank you.
Thank you very much, Honorable Adrianse. I see Honorable Adrianse set as an example. I will request all honorable members as well as the delegation from the department and the CDA. If you are presenting, can you please put on your camera just for a moment so that we as honorable members can see you. Honorable Breed.
There we go. I disappeared for a minute there. Morning, Chairperson. I will second the agenda or second the adoption of the agenda. Thanks.
Thank you very much, Honorable Breed. And welcome back. We have missed you. Honorable members, but Honorable Breed, I don't give you permission to get back to other meetings because you have a lot to talk about in this meeting on the agenda points. Honorable members, we are now on the agenda is duly adopted. Can we get the apologies, Marcia?
Again, good morning, Chairperson, members, colleagues. Chairperson, we received an apology from the Minister as well as the Deputy Minister. They are both attending a joint cabinet meeting this morning. Thank you, Chair.
Thank you very much, Marcia, for the apologies. Honorable Sibande also just indicated that he's struggling to log in. So, honorable members, Marcia gave us the apologies. Can I get a mover for the adoption of the apologies? Honorable Breed.
Chairperson, I move to adopt the apologies.
Can I get a seconder? Honorable Du Plessis.
Honourable Chair, I second the adoption of the apologies.
Thank you very much, Honorable Du Plessis. So the apologies is adopted. Honorable members, we are now at the next point on the agenda, briefing by the Central Truck Authority on the 2024-25 annual report and an update on the Truck Master Plan. I will then give over to the DG and the chairperson of the CDA to continue with the presentation. DG, over to you.
Thank you very much, Honorable Chair and honorable members. The CDA chairperson and members of the CDA that are in the meeting. I thank you very much for that. I think the apology has been given with regard to the minister and the DM, but today we are here to with the CDA to present the 2024 and the 2025 from the 1st of April 2024 to 31st March 2025 annual report of the CDA that we will be presenting. I must indicate that I think you will see also that in this there will be some few challenges that we have experienced, which is not by design, but something that the department has, and then we continually deal with these issues specifically, and also that one of the things that is important is that the CDA, in terms of the legislation, in terms of the Section 56 of the Prevention of and Treatment for Substance Abuse Act 70 of 2008 is an authority. It's not a board or an independent structure that has got its own budget, but it uses the budget that is within the department, which is managed by the department. Over the years, I think as we implement the and work with CDA, there are many challenges that we have already incorporated. For example, one of the things that we have done is that in the policy that was approved by Cabinet in 2024 October, a lot of issues has been addressed in relation to the budgeting, in terms of the structure, and the issues that I think the CDA itself have raised, the operating model. So we are presenting this, knowing that there will be there were challenges, and I think it's a working in progress for us as a department to ensure that the National Drug Master Plan is implemented for the country to benefit. This is where the country needs to look at all those goals that we have. I think the CDA will present that. And lastly, that there will be two presentations. There's a short presentation on the update on the National Drug Master Plan. It's an update that the DSD will do, and then before we do the discussions. Chair, thank you very much. And let me then give this opportunity to the chairperson of the National Drug Authority and members to take us through the annual report for 2024-2025. Thank you very much. Over to you, chairperson of CDA.
Yes, thank you very much to the DG, and thank you very much to the Honorable Chair of the meeting. And I do want to greet the Honorable Chair as well as the honorable members of the Select Committee. Let me greet the DG and the officials from the department who have joined the meeting, as well as the officials of the Select Committee. Thank you very much for this opportunity. I'm going to ask Chairperson to close my video so that I can drive the presentation. I hope I have your permission to do that.
You have my permission.
Yes, thank you very much, Honorable Chair. So let me try and do that. Okay. Thank you. I hope you can see the presentation, Honorable Chair and members.
We can.
Yes, thank you very much. I'm going to try and run fast in the interest of time. So basically, we are briefing the Select Committee on Social Services on the CDA's annual report. The committee will engage with us, of course, and will be able to respond to issues raised. But we are saying that one of the challenges is to hold all departments and entities that do not participate in the CDA accountable. And we are hopeful that the Select Committee will assist us in that regard. We are also going to provide, the Select Committee to provide support to the CDA to ensure that there is compliance to the law that establishes the CDA. And then moving on, this is the background, but in summary, basically, we are really presenting how the National Drug Master Plan has been implemented, because we know that the National Drug Master Plan is a strategy, a national strategy for addressing substance use, misuse, and illicit drug trafficking in a coordinated and comprehensive manner. And CDA doesn't work alone in terms of the act, which actually mandates the CDA to work with all the 21 departments. We also work with the Provincial Substance Abuse Forum. We also work with the local drug action committees, which are on the ground, and we work with the multi-sectoral stakeholders. In terms of our mandate, just do that. In terms of our mandate in the Act indicates that this is the Act of 2008, number 70. It indicates that we oversee and we monitor the implementation of the National Drug Master Plan. So the CDA does not necessarily implement the National Drug Master Plan, except for holding government departments accountable, ensure that there's leadership, and then we definitely coordinate. So we've done this. We have worked very closely with the departments, even though not all of them were participating. I think at most it was about 10 to 12 departments, but we've been able to, regularly meet with them to monitor the implementation of the National Drug Master Plan. But we've also met with a number of stakeholders nationally as well as internationally, really to oversee the work that is being done. We've facilitated and encouraged the coordination of strategic projects, including visiting the people on the ground, the communities, the public dialogues that we have held in all the 9 provinces. And we facilitated the rationalization of existing resources. And we've monitored their effective use. We've encouraged government departments and private institutions to develop plans addressing the substance use. Indeed, there were very few departments when we started which had plans, but as we speak, the numbers have actually increased. We have ensured that these departments have performance indicators. Indeed, those plans do have the performance indicators to measure the success of the work that is being done. And this is an area which has not been really done. We don't have information systems to support the implementation and evaluation of the National Drug Master Plan. Basically, we've been communicating with the stakeholders using our emails and other forms of communication. In terms of annual reports, we have submitted all the annual reports on the national efforts to address substance use and abuse in the country, as well as illicit trafficking, because this is not only about substance use and abuse, it's also about reducing the supply of drugs in the country, and hence we work very closely with the security cluster. We have also ensured that the Department of Health has developed effective prevention strategies, including HIV infection, early intervention and aftercare strategies, but we also have other departments like DSD who are also implementing this particular mandate. And we have advised government on policies and programs related to substance use abuse and drug trafficking. And later on, we'll mention what policies those are. We will be recommending the review of the National Drug Master Plan every 5 years. And we are actually in the process of doing that. And later on, this process will be presented to the committee. And we've organized biannual summits very successfully. And we were able to enable the role players in the field of substance abuse to share their information. And we haven't really received any further mandates from the minister. So, but as for the other mandates, we've been able to carry those out. So the National Drug Master Plan essentially is a strategy to ensure that the South Africans are safe and they feel safe from the harms associated with substances. Communities are resilient and empowered. Citizens have access to support and opportunity so that they live healthy lives, productive lives, and fulfilling lives. And we have indicated that actually the 2019-24 National Drug Master Plan has expired, its term has expired, and that we have been reviewing it in order to develop the 2026-31 National Drug Master Plan. The vision is still the same, South Africa free from substance abuse, but in the review of the National Drug Master Plan, we actually have reviewed the vision, we have reviewed the mission as well. Okay, I'm going to jump some of the slides so that we focus on the main issues. We've spoken about the purpose and we've spoken about the approach. And the key focus areas basically are about prevention and early intervention, especially young people who are affected in our country by drugs and harmful, and the drugs are harmful to them, assisting people to access treatment, rehabilitation, after-care reintegration. And this is the work that is done by the departments, not by the CDA. The CDA monitors and oversees this work. There has been disruption of illicit drug supply and strengthened regulation, public health responses to reduce substance-related harms, monitoring, evaluation, and research-driven. These are the principles that drive us. They have not changed in terms of the old National Drug Master Plan and the target population. In the interest of time, I'm not going to go through them. The 7 goals we have been implementing, the 7 goals: demand reduction, supply reduction, control of drugs intended for therapeutic use, identification and control of new psychoactive substances, governance, and all the above 4 goals have been implemented by the departments, and we have been monitoring and overseeing that work. Goal number 5, governance, leadership, and accountability, has been implemented by the Central Drug Authority, working with the Department of Social Development. Strengthening data collection, monitoring and evaluation and research has been done by the departments themselves. Stimulating robust and sustainable economic growth aimed at reducing poverty, unemployment, and inequalities was supposed to be implemented by those departments that are responsible for economic development. But we must say this is one of the challenges where those departments are not really reporting, so we're not too sure if they are actually doing the work or not. In terms of structural arrangements, I mean, we are 21 departments, as well as we are now 9 independent members of the CDA because 2 of our members passed on. So there have been vacancies for those 2, but one of them actually resigned to join Parliament. We have the structures in place. We have the executive committee, which has been functional. We have the 5 committees, which have been functional, and their work is included in this report. We also have a promulgated rules, which has been assisting us to do our work, to carry out our work and run our meetings. In terms of the secretariat, we do have a secretariat that's supposed to support the CDA, but as we speak, the law is clear on the kind of secretariat that we must have. We must have a director, but we don't have that director still. We do have 2 sub or deputy directors and the 2 administrators who are assisting the CDA. but they are not able to assist or CDA in every aspect. So there is a challenge there that needs to be addressed, and I think the DG was beginning to speak to that. In terms of the Provincial Substance Abuse Forum, all of the 9 provinces have PSAFs that are functional, and we just need to ensure that they are functioning in accordance with the law. And we see various configurations. For example, if you look at KZN, the PSAF is checked by the MEC, and that works for KZN. But I think what is important is that the MEC should also be able to oversee the implementation of the Provincial Drug Master Plan. And if you look at the Western Cape, there is a specific secretariat that's responsible only for the work of the PSAF. So, and then we look at the local drug action committees. The numbers have increased in terms of the local drug action committees from 135 to 213. We have worked with the mayors. We've attended the meetings of SALGA, and we have actually encouraged the mayors to establish the local drug action committees. And some of them have established, others have not established these local drug committees, which are very important to actually address the substance use abuse and illicit trafficking on the ground. So yeah, I'm not going to really dwell on this one, but yes, there are those challenges, lack of integration with municipal planning framework, and that's why we have been saying to SALGA and the municipalities, the work of substance use and illicit trafficking should be in the IDP so that it can be resourced by the municipalities. Some of the structural risks that we have identified as the CDA is in terms of the legislative context, that these structures that I've spoken about are legally binding and they must be in place, and they must be reformed when we look at the amendment of the Act. In terms of governance misalignment, I've spoken about the Secretariat. I'm not going to repeat that, but the fact that the Secretariat really is not 100% supportive of the work of the CDA, because they have to do the departmental work as well. So that has to be looked at. That actually bears accountability, and it affects the oversight effectiveness of the CDA. And then there's oversight capacity constraints in terms of the administrative gaps. I've spoken about that. The importance of whole of government, whole of society approach. It's important that we have a multi-sectoral approach to do this work, and that the departments should be consistent. We can't just have only 10 consistent departments, but we must have all 21 departments doing the work. So we are recommending strengthening of the governance alignment. The situational analysis is such that substance use abuse is still a very big problem, not only in South Africa, but globally. We are informed by the World Drug Report that 316 million people use drugs in the country. Africa and South Africa in particular are basically transit corridors. We are producing in South Africa, we're producing various forms of drugs, but we are also consuming. We're a consuming market. So we have also seen that there's increased cocaine and heroin that flows through the southern route from Afghanistan through the other countries right to South Africa. But we also manufacture DIC in South Africa, cannabis, and there's organized crime networks, and the supply is actually expanding. There's changing substance use patterns. Alcohol is the most used substance, followed by cannabis in our country. There's rising methamphetamine products that are being used, rising heroin mixes, and this is done in the form of Nyaupe Wunga. People are also using pharmaceutical opioids, the cocktail drugs, and recently we were informed that the young people are now using fire extinguisher, and the street name that is being used is actually chaff. And that's very, very dangerous to the lives of young people. And that's why it's important for those who are supposed to really prevent the use of these dangerous drugs to be on the ground, to be talking to the people. There's emerging new psychoactive substances, the codeine containing cough syrup that is being used. We've heard about lean etc. And we are also aware that there's about 75,000 people in the prisons that are actually injecting drugs, and this is very harmful. They also then are able to share, or to affect each other with HIV and hepatitis C. There's polydrug use. People are mixing drugs, and that's very, very harmful, especially young people. So we recommend the strengthening of law enforcement, evidence-based programs, community-led prevention, strong treatment and harm reduction, and looking at the regulation, amending the regulations, ensuring that they are really assisting in addressing this problem in our country, and that we need to really implement the evidence-based interventions that are actually suggested by the World Health Organization. In terms of the situational analysis in the provinces, you will notice that, in fact, in all the provinces, the prevalent substance that is being used, you see Free State, Northern Cape, Northwest, it is alcohol, it is heroin in the form of wunga, in the form of nyaupe, it is also cannabis. Same with the Eastern Cape, especially cannabis and alcohol. Same in Gauteng, cannabis, as you can see, alcohol and nyaupe in particular. KwaZulu-Natal, the same situation, Limpopo, Mpumalanga, and Western Cape. They are varying, levels of the use of these drugs. But indeed, I mean, the departments have been hard at work to reduce the demand in various programs that I've mentioned. The security cluster has been hard at work to reduce the supply, but the details of this work will be spoken about at a later stage. On stakeholder engagement, we've really been working with the multi-sectoral collaboration, the NGOs in our country, the international organs like the UNODC, the World Health Organization. We've been working with research institutions through the Department of Health, SAKENDU, and the South African Medical Research Council. And many of these institutions have actually provided the report of the work that they are doing, and hence you'll find it in the actual report itself. We are recommending the role of civil society to be systematically acknowledged, integrated into national policy development, and that we definitely need to embed inclusive stakeholder reporting of the implementation of the National Drug Master Plan. I'm not going to repeat, because I think these are the issues that I've spoken about in terms of the challenges and what needs to be done to address the challenges. I'm now going to ask Ms. Nomathemba Kela to take over and go through the financial report as well as the implementation by all the role players and stakeholders. Over to you, ma'am. Ma'am Kela. Honorable Chair, sorry about that. I'm not sure if Ma'am Kela has unmuted herself. Yeah, I don't know what's happening. I expected Ma'am Kela to continue with the report. Ma'am Kela?
Chair, maybe you can continue and she will join us. She will join on the way, Chairperson.
Okay. Thank you very much. I hope she will indicate when she has joined the meeting. So in terms of the budget, as the DG was explaining, we get an allocation from the Department of Social Development. And in 2024-25, we received 6.6 million. And that amount is basically for compensation of employees. I've indicated that we have 2 deputy directors and we have 2 administrators. And, that's the compensation for them. You can see that with the 2.3 million rents that was allocated, there's an over expenditure of that. The expenditure is 131.58%, which means that it's important for the department to really increase the amount of money that is meant for the compensation of employees. And almost all the years, there has been this over expenditure, which is a challenge. Goods and services, we allocated 4.1 million rands. And even with goods and services, you can see that there is over expenditure. And basically, I mean, this is a budget that has been historical. It has never been adjusted. It has never been increased. In fact, instead of being increased, it has actually gone down. At some stage, it was 7 million, and now it is 6 million. So the over expenditure is because of the historical nature of the budget under budgeting, but also as the CDA, we have indicated that we do not have control over the budget. As the DG has said, the budget is controlled by the social development. So it's not easy if we don't have the information. It's not even easy to say, why do we have this expenditure? So yeah, I see that Ms. Keller has actually joined the meeting, but she'll indicate when she's ready to take over the presentation. So we then are saying that the state of the breakdown of the expenditure is given there, and we are saying that some of those items that are in the budget really are controlled by the DSD. We are not controlling everything, all the expenditure of the department, and I think Memkela will also indicate later specifically which are those expenditure. I mean, for me, I recall that, for example, because we wanted to manage hello? Oh, Memkela, you are here.
Yes.
Okay, please continue. I've just started. So we are on this slide on the financial report.
Honorable Chair and members, department and officials, chairperson of the CDA, thank you very much for this opportunity. Apologies. I got disconnected due to network issues, but I think in fact I'm connected now, and I'm hoping that we'll be able to continue. Chair, if you can just move the slides with me, please. I think we were already indicating, Chair, that the financial report that we have a breakdown of the finances, and of course we need to actually note the high over expenditure that is indicated there. And I just want to indicate as well that the budget of the CDA, if you look at the slide, we say the budget of the CDA in quotes, and as the DG indicated, actually the budget is located within the social development. So the CDA itself doesn't have any control of this budget. What is under what we can account for as a CDE are the claims, 1,717, but even then we haven't got a detailed background of how those claims were paid, what was paid for, and whether all this expenditure went to claims. But the essence of it all, I think, is just for us to indicate that we don't have control of the budget. The control of the budget is located within the CDA, and in the reports itself, it says it's a CDA budget. So the only thing that the chairperson of the CDA is authorizing are the claims that we are making, just to verify that we did undertake the work that we have indicated in the claims that we have undertaken. And that's the only thing that I think she's aware of. Otherwise, the other line items expenditure, if you look at the commitments that are there, we are not sure what those commitments are. It says commitment under research and advisor. It has not been discussed with the CDA, so not fully aware of what is happening in that space. And then also the expenditure on the line items that are indicated here around the activities, to say that as you can see, that amount of 841 that has been allocated for the research advisor, and also maybe accommodation. We're not entirely sure what that accommodation is because the CDA holds virtual meetings, and it was with the attempt to cap costs. The car rental, we've not been traveling. Own transport, we're not sure what that refers to. Air transport, we have not flown. I'm sure there would be exceptions to this, one or two, but we're not flying. We are in the we as I indicated, we do virtual interactions and then add shuttle services that you see 1 million. We are not sure what that is. Foreign daily allowance, no one has gone overseas. Venue and facilities, we are not sure what that is. So it's difficult for the CDA on this budget to account for the over expenditure because we have requested reports from the department, but we haven't received any reports. And I just want to put it out there that we stand by this because this is what we're expected to report on the annual report, to say why are we having this over expenditure. But there's no way that you can report if we don't have the information. We have requested an internal audit from the department so that we can be sure that these things are verified, but we haven't received any response. And the chairperson has also written to the Auditor General to say, please just let's do the audit of the expenditure of the CDE and the allocation of the budget, how it's managed and so on. Still, we haven't received. Can it next slide? Chair? Yeah, thank you. So I think the essence of it all is that we don't have an independent and a dedicated budget that's allocated to the CDA. We are under DSD manages and does whatever with regard to this budget, and then reported expenditure that is attributed to the CDA. There's no financial authority correspondent, because if it is CDA, then the chairperson should have a say, and we've got a finance committee that actually would be looking at this and report on this. But it's not happening. We don't know. And then critical governance accountability risks. The budget has been static for 5 years, and it has not been adjusted. For mine, it's just minor adjustment, like about 100,000 rands or so, which we are not sure how it gets us, but it's not adjusted for inflation, especially on personnel costs. It's been that way. We haven't changed, but if you look, the budget, the expenditure has increased, but the budget itself has remained static. Over expenditure driven by baseline under allocations, and it's not because of operational inefficiency. And then limited financial transparency, as I indicated, we are unable to distinguish expenditure by CDA itself. And that would be independent members, because all the other expenditure of the CDA is carried by departments. So if departments have to travel, the department will pay. And the CDA is composed of 21 departments and the members, independent members. And then we also are not able to distinguish what the TSD is paying for versus what is paying for the secretariat. But then bear in mind that the secretariat accounts to the department and not to the CDA. And accountability misalignment, it's expected we're expected to account for expenditure, but we don't know. Even the service providers, we are not responsible. We don't know. And for example, a service provider was appointed in 2024, 2025 to do the editing of the National Drug Master Plan, the layout and the printing. No documents were printed. We did the work ourselves as CDA because of the quality that we received from DSD. But we don't know whether the service provider was paid or what. And then again, most major cost pressures, high travel, venues, advisory costs, despite limited physical meetings and unclear justifications for certain expenditure. Like I indicated, annual report outsourcing and the international travel. So we're saying that we actually need to look at this, and this has been going on for many, many years. The the APP, we had an APP for 2023, 2024, however, and we costed that APP, but it was never funded. Can we go on to Chair? Thank you. And human resource and organizational environment, I think Chairperson indicated this, that we have a secretariat, but that secretariat in terms of competence, and I'm not saying people are competent, but I'm saying in terms of the functions of the CDA, what is supposed to happen. If you compare the CDA to for instance, SANAC, it's completely unmatched, you know, in terms of resources. The secretariat, which is a whole administrative area that must be managed. So, and the director has never been implemented. We have to, as board members, including this report that we are presenting here, do the reports ourselves and present these reports ourselves. But even the crafting of the report, the editing and what have you, what you see, what you have as a report has been done by members of the CDA. And that also impacts on the finances. And then governance misalignment, as I've indicated this, I'm not going to repeat it. Structural constraints limiting performance. We are not able to do some of the work that we are doing. We are sometimes relying on donors that would find a way of supporting the work that we are doing. We need to look at the institutional alignment of the CDA in terms of the current legislation. I think this is very important, because whilst you are saying that the new legislation will come, but it's going to take time. But what is the current legislation is empowering. Can you go on, Chair? I think I'm going to move faster here. Yeah, I think Chairperson indicated how we have performed as the CDA in terms of our statutory mandate and how we've delivered. She went according to all the functions, strategic coordination and stakeholder engagement, policy and legislation contributions, including the BELA Act, the alcohol taxation review, and all the other inputs that you have made and discussions that you've had with Treasury. And then coordination, stakeholder engagement. We have really gone all out to interact with the public, to NGOs, other entities that are international and local, that are there, because ultimately we are responsible for the program of substance use and drug trafficking in the country. And then program and system strengthening, that we have also looked at the issues around harm reduction, as a Chairperson has indicated. And visibility, the CDA is known in the country, and the National Drug Master Plan is known for the first time in the country. People talk about the National Drug Master Plan. So we've put in a lot of work around that. Can you go on, Chair, please? Next slide. And then I really want to just, because most of the things that are in the slide have been indicated, have been outlined already by the Chairperson. But all our structures are working, and we are active, and we have the 10 national departments have reported across all goals. And here we give an indication, but I'm not going to go through it because the Chair has. But in terms of goal 7, socio-economic integration, forensic backlogs, and NPS, those are the areas that are weak, and those have been integrated. We've looked at way of strengthening these areas in the National Drug Master Plan. Can you go on, Chair? Before we go to I think I need to mention, Chair, that throughout all the years that the CDA has been there, we've been having the National Drug Master Plans in this country for the last 27 years. And in all throughout, and with all the CDAs, there have been specific recommendations. And when the 2019-2024 NDMP was approved by Cabinet, there was a strong recommendation, or rather a directive given to the country to say, this is where how we want the structure and form of the CDA to be. And unfortunately, that's still outstanding. And then government departments, I'm not going to go into this, Chair, but these slides just indicate the work that has been done by the departments, which departments have been key in these areas, and then what contributions they've made. And then we also highlight the weaknesses and recommendations. And then that's goal 1. In goal 1, which is demand reduction, harm reduction, and treatment. Next slide, please, Chair. And then supply reduction, again, we have done the same. We've looked at the performance of, and the departments submit consistently. They submit annual reports, quarterly, by annual reports. The provinces submit quarterly reports to the CDA. And these are the reports that we evaluate, we look at. However, we cannot look at the veracity because we don't have a strong monitoring and evaluation system as yet in the country. And this is addressed again in the new National Drug Master Plan. Let's go on, Chair. And then goal 3, availability of substances for medicinal and scientific use. There are reports, though a bit scanty, but the reports that you are getting are from the Department of Health and from SAPRA, and they are indicating how much they are managing this, especially the diversion of these substances for wrong purposes. But also we are proposing that we're very strong on proposing on the National Drug Master Plan that the medication that is required for the management of substance abuse, for instance, opioid substitution therapy for opioid dependency, that it needs to be highlighted because much as it is expensive, but the consequences of that in terms of the health of members of the public and the people who use drugs is very, very critical. Next slide, please, Chair. And then identification of new psychoactive substances. The example has been given by the chairperson now on the emerging trends around substance abuse or substance use. And then we've with regard to the one of fire extinguishers, we've engaged the Department of Basic Education. They have actually issued a directive to their to all their schools, and they are keeping the matter in check now to see what is happening. And they've released a statement, and so has the CDA in as far as this is concerned. But there are others that are flowing through the country, through various means that you are not aware of, and we are asking, South African Police Services to be vigilant around this, and there's fentanyl, the risk of fentanyl that is wreaking havoc all over the world, especially in the US, where people are dying in numbers, and we're saying that we are monitoring this, and SAPSAM is saying is really doing a good job in this area. I haven't looked at, I'm not giving the details and the numbers. Can you go on, please? And then we have governance and accountability. We've spoken a lot about this, but also our interaction with the AOU, with the AU, the BRICS, UN, SADC, and even the interaction of the National Department of Traditional Affairs and the House of Traditional and Coalition Leaders, and the role they're playing in SADC and in the rest of the African continent, supporting each other and ensuring that this thing is managed. Can you go on, Chair? Sorry, I need to move faster. And then we have research, monitoring, and evaluation. Yes, the departments have given us an indication of what they are doing and the systems that they've put in place. And for monitoring and evaluation, but also the research that they are doing. We've just now also opened this up to the institutions of higher learning and the other key sectors in the country. Can you just proceed, Chair? And then research, monitoring, and evaluate economic growth to reduce poverty. This is a bit of a challenge for us. DSD is implementing an anti-gangsterism trusting strategy across all 9 districts in the country, and DBE is also looking at the curriculum integration, but also is working with donors to provide learner support assistance and drug tests, doing drug testing in the schools themselves to manage the issue. But it's a very weak area, because even the people that come from rehabilitation centers or from treatment centers, they're not integrated into the community, into the social, economic, and cultural milieu of the community. And then drug demand reduction, Chair, this is an indication. It's numbers, it's provinces, the numbers that they have given us and the work they are doing in the specific province. If you'd allow me, Chair, I'm not going to go into this with the numbers. It's just we're going to look at it later. But in a very brief way. Otherwise, we're going to take a lot of time of the committee, and I realize already we've got limited time. Can you go on, Chair, please? Extraction, demand deduction, and in goal 1 as well, KZN, Gauteng, and Western Cape, please. And interestingly, in Gauteng and Western Cape, they are now integrating issues around mental health in their work on substance use. So I'm not going to go into the detail in each one of them and read everything that is happening, but Northern Cape, Mpumalanga, and Northwest, the details are given there. And we think that this is very important because NCOP it's mainly concerned about provinces. But that's it on coal demand reduction, drug demand reduction. Go to. We see what the Eastern Cape is doing quite a lot. In Free State, it's also quite a lot that I'm not going to go into that, but I'll do something. Can you go on, Chair, 2 provinces? And the other 3, it's indicated there. But we are very, very concerned, especially with alcohol and the registration, the licensing that is going out of hand. Licenses are being given, and we've got taverns next to schools and what have you. We've interacted with the liquor board, and the provinces are also doing that and doing inspections. But unfortunately, there aren't enough inspections when you look at the demand, and there's not enough community participation as well. Can proceed, please, Chair. And then in KwaZulu-Natal, again, the same issue. Limpopo, the same, though to a limited extent as compared to KwaZulu-Natal. And then you have Mpumalanga as well, and the work that they are doing around the borders, for instance, and monitoring of the borders in the country in Mpumalanga. Okay, next one, Chair. Yeah, and also identification and control of new substances. It's only SAPS that is reporting on this extensively. 3 provinces also report on early warning and systems and forensic indicators. So we want to look at it in the we're looking at it, in fact, in the 2026 and 2031 National Drug Master Plan. Please proceed, Chair. I'm trying to save us time, and we go on. That's Eastern Free State, the Eastern Cape, Free State, and Gauteng. And then next one. Let's goal 4 in terms of identification. And goal 5 is essentially saying that all the provinces are functional. They've got PCEPs that are functional, and they are having meetings, and there are a lot of activities within that. And for instance, in the Eastern Cape, where they are partnering with the University of Fort Hare to do some research on substance use. And yeah. Can you proceed, Chair? I'm sorry, I'm not, I should be giving a lot of attention to this, but we are not because of time constraints. Again, alcohol, GBEVs, and mental health are cross-cutting issues that we are giving attention to, and the provinces are also giving attention to these matters. But I just want to reflect here on the next slide. This is a dashboard that actually tells you how many people are being reached in each province for each of the goals. Goal 1, you can see the numbers there with Gauteng at 6.7 million, and KwaZulu-Natal 3.49 million people being reached with awareness programs and prevention programs, which they are implementing. And then also in supply reduction, what's happening, drunk and driving under the influence arrests, liquor, school enforcement, metro drug arrests and confiscation, breathalyzers, and all that, Chair. Liquor operations and roadblocks that have been conducted, and then liquor compliance that they are doing in line with the liquor boards, and then screenings and inspections. And then NPS, you can see that new psychoactive substances, what is happening, the contraband removals in some of the provinces like Gauteng, drug seizures, school safety, border monitoring, campaigns in the Northern Cape, and GBVF framing in the Northwest, and then harm reduction focus in Western Cape. And then in terms of governance, that's goal 5. You can also see that PCFs are functional. They've launched local drug action committees, and the number of local drug action committees that are active per province, no, is not indicated in all provinces. Next slide, please, Chair. And then this is the challenge that we have. The Act says that the local drug action committees must be established in each municipality. So the calculation has been that number of municipalities is this, therefore so many drug action committees must be established, that it must be the same number. The Act doesn't say anything about the decentralization, but to make the National Drug Master Plan visible in communities, to enable people to manage the National Drug Master Plan at a local, so for it to be felt at a local level, we are looking at the issues of decentralization. If you look at the slide, you see in some, for instance, in some of the areas like KZN, the numbers are more than, in fact, later. Beyond this period, they've got more local drug action committees than the municipality. The reason is because they have decentralized. They're saying it's not against the Act to say in the metros, for instance, you have your substance abuse forums at a municipal level, at a metro level, but they've decentralized and said at a regional level we need to do, and some of them have decentralized to the local level. The Act doesn't say you may not do that. So it's something that we are actually looking at and really addressing in the new National Drug Master Plan to say what should we be doing. The other issue that's important here, Chair, is that we don't have a framework that allows us, or a implementation guideline that allows us to connect all the dots, because even where the local municipalities would be saying this is an unfunded mandate, it's addition to whatever, but if it's integrated into the IDPs, it's also integrated with the work that the department is doing and other departments are doing. I think a lot can be achieved here, and this is what we are attempting to do at this stage. Can you, well, we tried. It's going to be the new CDA, because at the moment we have not been able to finalize that work. I've addressed the issues here. We have also indicated the issues around a fragmented coordination with other municipal structures and programs, and also not just municipal, but also the district development model. We haven't implemented it to the extent that, and we believe that if it's not in the one plan, it won't be funded. So, or if it's not in the IDP, it won't be funded. But we need to empower municipalities to understand, as the chairperson says, that we've engaged SALGA, we've participated in a lot of their study groups, and they are beginning to understand and to really implement the local drug action committees. And the other challenge is that some of them, we are not able to sustain them, because even when they are established, they dissipate because there's no funding to sustain them and all those kinds of. So what we are saying is that we need to have a clear governance positioning, funding alignment, and integration into IDPs and DDMs, and also funding, and that we also have that framework that is very, very critical for us to have uniformity across the country. Next slide, Chair. I'm finishing. That's the conclusion. I think really we need to look at, as I indicated, a strong legislative and policy framework. One of the challenges that we had with the department's reporting is that they're saying, and this has been happening over for over many years, that we can't be reporting to another department that is our peer. So the legislation needs to be looking at these issues, but also that we do have a very strong, I think it's something that is indicated all the time, that we have a comprehensive legislative and policy framework, and especially with the national thing, but implementation is weak. because we, as a CDA, we are not properly structured, we are not properly positioned. There's a lot of work that, and I must commend our provinces, they are supporting the CDA, they are working very, very hard. They're submitting reports, and where we have advisories for them, they go out and look at those issues and they implement them. And those departments that are also participating are very key, like for instance, SAPS, they are very, very active and responsive. They've begun, for instance, to look at decent and not arresting users, people that use substances, but rather that they get referred, and they don't get referred for treatment rather than get incarcerated. But the reality of the situation, we don't have such enough treatments and facilities, and we have fragmentation in terms of how we are monitoring, reporting, and we have weak data systems, and limited institutional capacity and secretariat resources. And this has been happening for the last 27 years, and we feel that it's urgent that it's addressed. And then it's also in the National Drug Master Plan. I'm not going to belabor. I think we've come to the end of this particular presentation. But allow me, the chairperson has requested me to just reflect on the National Drug Master Plan and what has been done. The process was, we initiated as a CDA already in 2023, hoping that by 2024 we would have finalized the process. But the DSD, of course, did the work that they did. There was a lengthy process of consultation, and the document was produced by CDA that we got to see and commented on. But beyond that, we are not sure. I'm sure in their presentation they will give an indication of what has happened subsequent to that. But on our side, when we got the document from the stakeholders or our stakeholders, what we did is that we looked at the document, and we really identified some gaps. For instance, we looked at what came through all our reports from provinces, from the national departments. We looked at what came through from the summits, for instance, the 2023 summit and the 2025 summit. Those issues needed to be integrated. We looked at your inputs, the portfolio of Parliament, the portfolio committees, the issues that they were raising, that were gaps in the implementation of the National Drug Master Plan. We also looked at the form and structure of the CDA, and looked at through extensive studies around how of other authorities, for instance, NPA is structured, and why is it an authority? What powers do they have different from the CDA? But we also looked at the other similar organizations like, as I indicated, SANAC and the Commission on Gender-Based Violence and Femicide, that are service-related, that address social issues that are similar to that of the CDA. And we then looked at different models to say at the moment, whilst we don't have with the current legislation that we have, what can be done? The 4-pillar strategy that is proposed by the United Nations, UNODC, for other countries and for us as well, we looked at that and we developed that. So I don't think we've got a final draft that we have, that we've consulted with the stakeholders of the CDA, and we then will be presenting that. But I think it would require that we have a special consultation, I don't know when and how, where we can actually brief the committee and Parliament on this. But this presentation by the document that is the department has come up with, we'll look at what it is saying, because we are not privy to it at this stage. Thank you, Chair.
Thank you very much, Ms. Keller. Can we go over to the DG for the update?
No, thanks very much, Chairperson and members. We have got a short update on the the development of the drug master plan. Indeed, as part and parcel of the review, we're still going to meet with the CDA because the review that so that we have got a final documents that incorporate everything. Thank you very much. I will then request Caesar to take us through the process, and she will. I think we'll give her 5 minutes, then we are done. Thank you very much, Chairperson. Allow her to do the presentation. It's written there on the presentation what we're going to do, and then the last consultation with the CDA on the review, so that we can incorporate whatever is there into one document that will be present, which will be a national drug master plan. Thank you very much. Bill.
Thank you, DG. Good morning, Honorable Chairperson and Honorable members. I will run through quickly. The first part, we are really indicating here that as a department and the sector at large, we draw our mandate from the legislation which is called Prevention and Treatment of Substance Abuse Act of 2008. And this act, it also gives mandate to the Central Drug Authority to recommend, Chairperson, I want to emphasize, recommend to Cabinet the review. The CDA is not responsible for crafting the National Drug Master Plan, but they recommend to the department as well as the 21 departments to come up with a country plan. And also as a Department of Social Development, we are then, once the recommendation is done, we are then requested to develop a plan. And I must emphasize the plan is an integrated plan, and it's a plan that reflects the commitments of the 21 departments, because the 21 departments are the one that, breathe life to the National Drug Master Plan, as well as the activities of the civil society, because we are not the only, structures that are implementing, but we are co-implementing with the civil society. So that's the process that we followed. It's also important to indicate that the plan itself, the blueprint, we must make sure that at the end of the day, it set out controls as well as how we are going to manage both the supply and the demand of reduction in the country. The next slide is about the consultative process that we have undertaken as a sector. I want to emphasize the sector because when we started this process, we called about 10 key departments, and those departments we established a task team. The task team also consists of members of the CDA. 2 of them were part of the task team. So we started with, as a task team, to look at the consultation, because we understand that all the 21 key departments as well as the provinces, their commitments must be reflected on the plan. So this slide is about the provincial consultations without necessarily going through each and every item, but it is important to indicate, Honorable Chair members, that we did dialogues in all the 9 provinces, and we started this process way back in 2023. It's not something that started now. We started in 2023 already, and out of the inputs that we received from the provinces, we consolidated, had a report that has informed the zero draft. Then after the zero draft, consultations continued with in some of the consultations, MECs of the provinces attended, HODs, provincial substance abuse forums, local drug action committees, as traditional leadership was there, faith-based organizations, civil society was there, treatment centers, and so on. Quite a number of stakeholders were there, diverse groups were consulted. Furthermore, CDA also had additional consultations. These are the dates. They started in June 2024. We also received their inputs in April 2025. We continue to improve the draft. From zero draft, now we are at a 7th draft. The consultation did not only be confined to South Africa, but we also consulted internationally. Internationally, Finally, we've engaged United Nations on Office of Drugs and Crime because it's very important that some of our pillars are aligned to that, and we are the signatory as South Africa. We're the country member, so therefore it's critical that the United Nations Office of Drug and Crime are consulted. We also consulted WHO, World Health Organization. They gave us inputs, especially on issues of alcohol. They are big on alcohol. We've also received sign-off inputs from 21 departments. The DGs made it, they emphasized to us that any inputs that must go into the National Drug Master Plan, they must be signed off by those departments because those are the commitments and there must be budget attached to those commitments. So we had to consult them and a number of stakeholders that I've already alluded to. In terms of the further engagement on this, we then took the draft as well to DPME because in cabinet they would not consider any draft that DPME has not signed it off. They need to evaluate it and make sure that you are given a certificate called a SASA certificate. There are certain requirements for you to meet that. They've looked at the draft and they gave us the certificate. They are happy with the input so far, but that is not the final certificate because they are aware that we are consulting. But we wanted to make sure that we are on the right track. That is why we had to consult them. And furthermore, we've also developed the following, supporting documents to make sure that the Drug Master Plan, once it's done and approved by Cabinet, it has those supporting documents to ensure implementation or successful implementation of it. The first one was the implementation plan. Because when DPME at some point conducted a evaluation, one of the things that they've indicated to us was the fact that the National Drug Master Plan, the previous master plan, did not have the implementation plan. So it was important that we develop an implementation plan that will ensure that there's better implementation. Secondly, we've also worked on the framework. The framework is led by MNE to ensure that we come up with targets that are smart. The third one is the communication plan. Again, on the evaluation report, there was an indication that CDA is not known. A lot of people, they do not know it. So very important that GCIS must come up with an integrated communication plan that would, be implemented, would communicate about this plan using all various platforms. Lastly, we also look at the costing because one of the challenges was that the National Drug Master Plan was not costed. It was a plan that has beautiful targets as well as pillars and goals, but there was no costing attached to it. Hence, it was difficult for the departments to actually implement it. So a costing a framework was developed that would guide all the departments, and that framework has been shared with 21 departments. Then these are the last two slides. In terms of as we are continuing to consult, we've consulted a technical working group. We've consulted DevCom, which is the JCPS cluster subcommittee. We consulted JCPS DGs. We consulted the SPCHD clusters. It was very important that we consult the DGs because the DGs were complaining that much as they've got reps that are representing them at the CDA and many other forums, but there is no, sign off. They want things to be signed off so that they can be held accountable for those commitments. So it was very important that they must be consulted and they must see that their inputs that they've given us are actually effected. So hence they were consulted. So we are not done with the consultation. It's work in progress. So the next step, we are continuing to consult. As we've said that we are aware that CDA, they are working on their inputs, so we will receive those inputs. There will be engagement to receive those inputs. We are also continue to consult the clusters, because as we are with the clusters, they are also recommending to us which are other further clusters that needs to be consulted to make sure that this blueprint, it covers everyone in the department and there is a better buy-in. And once we are done with the consultations and we have included all those inputs from everyone, from all the sectors, from all the clusters, we are then going to finalize it and then hand it over to the minister. The minister is the one that will table it in cabinet once it's finalized. It is recommended that the selection committee note the progress registered on the development of the National Drug Master Plan. I thank you, Chair.
No, thank you very much, as a chairperson and members. As you see, there's still a lot of consultation to make this national drug master plan. I must indicate, yes, some of the things that the CDA raised is things that we have incorporated into the new, as we go into the new drug master plan, and not to repeat what has been there, and address issues so that we have got a state-of-the-art South African plan on substance and alcohol and substance abuse. Thank you very much, Chairperson and members.
Thank you very much, DG. And thank you very much to the members of the CDA, as well as the department for the two presentations. Honorable members, we have received the presentations. Can I get hands in terms of comments on these presentations? I only see Honorable Du Plessis, then Honorable Mhlongo, Honorable Breed, Honorable Mampuru, Honorable Adriaanse. It looks like all of the members have some issues. Honorable Kennedy, Honorable Fanny, Honorable Makwele, and I think Honorable Pet. He's just struggling to put his hand up. So let us start with Honorable Du Plessis.
Thank you very much, Chair. Through you, I do want to start with a concern that we cannot really accept this or adopt this report if there's such a massive financial discrepancy within the CDA's overspending report, and monies were spent that they were not made aware of. So I do want to start off by suggesting that we do not adopt this report until we get a full investigation, on the overspent amount. Chair, there are a few other small concerns. They're all actually rather big concerns. They all revolve around planning and financial management and controls and oversight. Firstly, I'd like to find out why the drug survey was not done post 2023-24. Is it in order to minimize embarrassment? Because we know anecdotally that the drug scourge has increased exponentially within South Africa, and regardless of all the fantastic sounding progress of the drug master plan, there has been no real on the ground impact on this. So first question would be about the survey and why there is no accurate data available post 2023-24. Then with regards to the timeframe for ring fencing of funds for the CDA, can we please get a timeframe? Why is there no timeframe? Is it again with regards to accountability measurements or governance processes that are not matching within the various implementation agencies and departments? Then with regards to the Secretariat, how long has this been an issue? What exactly is the hold-up that the Secretariat is not functioning and capacitated to its full capacity? With regards to the LDAC, I'd like to find out what exactly is the plan to ensure that communication goes out on this. Does every single public representative or local councillor and also official that needs to implement this, are they aware of their role within the drug master plan? Or was this just a half-baked plan? Because it's starting to look a little bit like that, and that worries me. The oversight constraints are massive. It is, and the oversight misalignment is quite big. I'm also concerned about the overspending on compensation of employees. Why is that happening? Then I do want to commend the CDA with regards to making sure that their meetings are on Zoom in order to cut costs. If only more task teams and implementing agents would do that. But that really brings me back to my first part of the question, which is millions and millions of rands have been spent on venues, facilities, shuttles, overseas travel. Who is this benefiting? Where's this money going? And that really is of a massive concern. Then I'm also concerned about the fact that the drug master plan was not costed beforehand. Surely all plans and programs need to be costed before they get adopted and implemented to ensure that there isn't a sort of scope creep within the financial aspect of the plan. I did speak about the consultation plan, but I would like a more proactive approach to consultation, because we can say consultation, but it's just a word until there's an actual plan with costing, with implications, with timelines. Because if you fail to plan, you plan to fail. And right now, the plan is not working. I'm also concerned that a plan that has been years in the making, many, many years in the making, is suddenly now revamped into a new drug master plan. So what exactly does that imply? Thank you very much, Chair.
Thank you, Honorable Du Plessis. That was sweet and short. Honorable Mhlongo, can we all go after Honorable Du Plessis in terms of shortness? Thank you, Honorable Mhlongo.
Thank you so much, Chair. Wow, Chair, you're putting me under pressure. Thank you, Chair, and greetings to the department. As my colleague has covered some of the things, I'm not adopting this report. It is sad that as leaders, let me call ourselves leaders, as leaders, we are failing our country. I was part of the PSEF forum, and we were busy with the same document. And then this term again, we are doing the same document. The funds are being wasted on hotels and transport, but there are no fruits, which is a very sad fact. And I don't understand with regards to the PSEF. I know PSEF in KZN is not active. And we can actually get a report from the PSEF members that they are not active, and yet here it is stated that they are active, which means this is not a true reflection of what is going on, because the department has failed to reach our people on the ground. You are not active when it comes to the National Drug Master Plan. And here we are again on this term doing the same thing that we were doing last term. And then another thing with regards to the CDA, I want to know if the CDA is going to endorse the National Drug Master Plan. If they are, that's great. If they are not, I'd like an explanation why they are not endorsing the Drug Master Plan. And then secondly, the last term, the previous term master plan, why did it fail? Why was it not activated? Because we've got stakeholders who resigned because there was no productivity in the drug master plan. So I want to know, how is this term going to be different from the previous term? Otherwise, Chair, I'm not impressed at all, and I'd like us to do further investigation on this matter, because this is a pandemic, this is a serious matter. Millions of people are losing their lives. Millions of people are getting affected. And if we let this go, then we have failed as a nation. Thank you, Chair.
So you are done, Honorable Mhlongo. That was also sweet and short. No pressure, but the pressure is on Honorable Breed, please. Honorable Breed.
Chairperson, you know I like talking, so the pressure is really on. No, Chair, let me welcome the two presentations and then just concur with what my fellow members have said regarding adopting this report and raising their utter concerns. I also made notes, and I think I have been largely covered by both Honourable du Plessis and Honourable Mhlongo, but I am also worried about the finances. If you look at goods and services, Chairperson, there's 176% overspend on that. And I would like to know what are the main drivers of that and how are we looking at improving and implementing that. I also think Honourable du Plessis made a very important point on the amount spent on travel. I think it was in the area of, 2 million or 3 million, and yet they say they have Zoom meetings. Chairperson, I'm very worried about the finances and the misalignment that was spoken about, and the fact that we are not, I've lost my English words now, but that the CDA does not know what they're spending on and whether service providers have been paid or not. And I think we need to look into this, because you cannot run you can't run an entity, you can't run a business and not know whether your suppliers are being paid. And then, Chairperson, getting to that, what does that mean for the implementation of the drug master plan if we're overspending and we're not actually seeing concrete plans? What does that say to us? What is worrying that there's no director currently at the CDA, and I would like to know how long will it take to replace or to fill that position, and then continuing with positions, what is the current vacancy rate within the CDA? Because we are overspending by some 100 plus odd percent. I think it was 700,000. So what are we overspending on, and what is the vacancy rate currently, specifically taking into account that we have no director? And Chairperson, then they also mentioned, I think it was the last presenter, Mrs. Keller, that said there's a problem because they are reporting to a peer. And by implication, thus, it seems to me as if they do not want to report to DSD. So what is the CDA's proposal then that they should be doing if they are not reporting to DSD? Chairperson, let me leave it at that for now. Thank you.
You are taking that pressure. Thank you very much, Honourable Breed. You are using it in a good way. Honourable Mampuru.
Yeah, thank you, Chair. You know, Chair, I was going to move different from my colleagues, but I can't, Chairperson, because I am compelled to concur with them, considering that we have families that the future of their children goes down the drain, careers get destroyed, communities, get to be destroyed also. Well, we have officials who can spend 124,000 rand on car rentals only. Like all these over expenditures and wasteful expenditures that appears here makes it difficult for us to even try to adopt this report. Because how are we going to adopt a report where officials can say, we do not have further clarity because we did not receive a report from other entities, which means that they cannot even explain how they got to find themselves on this amount which appears here. So it makes it extremely difficult for us, Chair. Adopting this report will mean that we will be privy and we must be accountable for all this amount which appears. So we can't, Chairperson. Chairperson, I just want to speak, just that my gadgets are giving me a problem here. I just want to check, Chairperson, that with the plan that is here, because what we have is just a plan and its implementation does not reflect in communities where we come from. It's just a plan which is just on paper. Physically, our people cannot feel it. Our people cannot touch it. And the problem of drugs continue to encroach itself in the life of our people. As having such a chairperson, I would agree with all my colleagues in saying the report cannot be adopted. We cannot agree with it on the basis that even the department themselves, both in the reports, do not have clarity on what they have just presented here. Thank you, Chair.
Are you finished, Honorable Mampuru?
Yes, it's done.
Okay, thank you, Honorable Sibande. Honorable Adrianse, you are next.
Thank you. Can I keep my video off, Honorable Chairperson, as I was already on the
Yes, you
platform?
may. You
Thank
may.
you. Okay, I'm on par with my colleagues. The report is, thank you for the report, but it's not enough. The capacity constraints, you can't effectively do oversight when you are not, when the board members have to do operational work. So that's just a statement. Now, the lines are blurred of accountability. So the CDA, that's what I gathered from the presentation. So the Department and Social Development. So can the authority clearly explain where responsibility lies with regards to the targets which are not met? Then the non-compliance and accountability. I picked up that 10 government departments submitted reports, but there's departments who didn't submit reports, if I'm correct. And what consequence management steps were followed for these departments? And my next question, I'll be as quick as possible, the pressure is on. The fact that the department doesn't have their own budget, that makes it difficult to be accountable. But then, who is going to be held accountable and what procedures are in place when procurement comes into play? And the fact that travel and outsource and annual report preparations is unclear on the expenditure of that, there must be internal audit processes conducted. And I can't really see from what has been presented that it is being done because of the blurring in the lines. Now, we sit with a massive problem as clearly indicated. And yet, the monitoring systems remain fragmented. And at one stage, I was myself part of a LDAC committee, and the leniency towards the abuse of alcohol and other stuff was quite shocking from the members on this committee. And we really know because we are becoming tick boxes when we get to LDAC committees. They are being counted instead of monitoring the effectiveness. So I want to know what the CDA's plans are to monitor the effectiveness of these LDACs. Because at the moment they're simply counting whether they exist and have some meetings, municipalities to have them established. But we sit with kids buying drugs just outside the fence during breaks. And the monitoring systems are not in place. And we sit with drug addicts Bluetoothing in the public at taxi ranks. So we need real intervention. Alcohol abuse are one of the biggest issues, and yet we sit with liquor licenses just being distributed freely in a square kilometer, there's about 10 liquor licenses issued in Northwest, while the relevant authority said no to this. But nothing happens. What coordination exists between the CDA, SAPS, to disrupt this from happening? Then the conclusion of the report states that South African substance abuse response is a good policy, but the system is constrained. Now, the core challenge, would you agree with me, is not a lack of policy, but yet again, as in so many departments, a failure of execution and accountability across the different spheres and of government. And what concrete steps are you taking to address this? This can't go on. If I look at the Northwest, there's 135 of 230 municipalities who have a LDAC and to implement the drug master plan. How many municipalities are functional in Northwest? And what oversight mechanisms exist to ensure that municipalities such as Matlosana, JB Marks and Rustenburg, where this problem is really intense, integrate substance abuse strategies into their IDPs? I thank you, Chairperson, because we need to work together on this, and the provincial liquor authorities must also come into play, because the proliferation of unlicensed liquor outlets in our vulnerable communities, especially in Northwest, is just overbearing. Thank you, Honourable Chairperson. I stop there.
Thank you, Honorable Duplessis. Honorable Adriaanse. Yes, Honorable Adriaanse, the pressure didn't help with you, but it needed, the things you said was needed. So we will move over to Honorable Kennedy.
Thank you, Chair. Can I speak without video?
Honorable Kennedy, I don't know. We can't hear you. You are unclear, really. So I don't know.
Our nation, and we do value the mandate of CDA together with NDMP as relevant to our rescue. But there are so many holes to sense the CDA indicates.
You are mute. You are now gone, Honorable Kennedy. So we will move over to Honorable Fanny while Honorable Kennedy is still trying to connect. Honorable Fanny.
Thank you, Chair. Good morning, honorable members. Chair, I think honorable members have made. Let me first accept the presentation and that was made, Chair. But mine, Chair, is just to reaffirm what has been raised by honorable members. Specifically, Chair, on the question of accountability, I think the select committee have explicit on that one, have raised it very sharply. Where there's the question of the the program itself, it does have need some fine-tuned in terms of the report, in terms of the program, in order to reflect what it seeks us to do as a select committee. And also on the question of finances itself, you know, just so that when we're adopting it, at least we adopt you know, a report that we said it's a work in progress, but not in this form, because it leaves, you know, a lot of questions before we can even try to come up with anything. So mine, Chair, is simple, that I think the report was premature to be presented to us, as it highlight, you know, for instance, there is also a new drug that is being utilized that has been highlighted, but is not explicitly, you know, you know, the approach on how do we correct it, the issue of this new drug that we have identified. So I believe that we still need to do some work on the report, Chair. And then it comes back again to us, at least with a finer detail on certain issues. Thank you very much.
Thank you, Honorable Fanny. We will now, I don't see Honorable Kennedy. Are you back?
Yes, can you hear me? Am
We
I
can hear you
audible?
now. You are now audible. You may proceed, Honorable Kennedy.
Okay, I will be short. I just want to be clear where implementation is lacking or struggling. Are there any actionable implementation plans that define how their strategies are translated into measurable local level actions? And in their quest for efficient planning for a successful interventions, is there any systematic, comprehensive data collection and research to inform their policies? Thank you, Chair.
Thank you so much, Honorable Kennedy. Next in line is Honorable Makwele.
No, thanks very much, Chairperson. Greetings to you, honorable members in the platform. At the Department of Social Development. Maybe, Chair, I'm also going to be brief. Like to say, let me note, because I don't want to use another word that suggests something. Let me note the report presented by the Department of Social Development, but also to agree with some honorable members to say that we are not saying that everything in this report is rubbish or is nothing. What we are saying that we are also taking from them when they are saying that, especially with regard to finance, some other sectors, they never received the report from them. Because remember, as the select committee, what we are chasing, we chase state resources, and also to make sure that the money that has been allocated to the department, it is used for the purpose that is supposed to be used for. But if themselves, they bring a report before the select committee, they expect us to adopt everything, but they are unable to account with finances. They are still saying that they never, because according to me, maybe, Chair, if maybe they had, according to the schedule, they were supposed to come and present before us. They were supposed holistically to say that we are still gathering all the information so that when we come before you, we have all the. I've got some few questions that I need to ask, but for now, Chair, I'm going to reserve them, especially with the issue that I think they are not extremely bad. Just like to check what are they doing, how do they interact with other departments, because the issue of drug abuse does not only fall into them. There is a Department of Science and Technology, Department of Education, Health, and other. How do they interact? So that us as the member of select committee, when we meet with other departments, we know how do they complement each other. But other than that, I'm going to reserve that question for now, Chair, to say let's make sure that they bring all the report with everything they are able to account to us. Then we are going to be able to interrogate the report. Thank you, Chair. Let me also pause here and follow that pressure of Honorable Andreas. I don't know who was the first speaker. Thank you.
Thank you very much, Honorable Makwele. I'm pleased with you, Honorable Makwele, because you were just sweet and short. So, Honorable Sibande, you are the last one, and I think you must follow the crowd. Thank you, Honorable Sibande.
Before I start, you restricted me, so it's very difficult. Chairperson, you see, I don't know how to put it from my side, because there is something which is put in front of us. I think the approach which must take, I suggest, is to say, go back with this report and we give them, maybe, I don't know, in terms of the guidelines of the Constitution, maybe we give them 2 months or 3 months, whatever time, to come back with a proper report. Because I will be following, myself, I won't follow what was said by the colleagues. I don't underestimate what they've said. But if a person is mandated to oversee something, but they come back to you and said, you know, I've got a problem with regulations. Who's supposed to deal with regulations? Not us. That is us. They didn't hide that. And also, they've indicated that their budget is from a certain department. You see? So my take is that the issue of accounting in terms of the money, for example, the money which was raised by Honorable Mampuru, why don't we link their presentation with that money to say, go back to this department? We need to know some of the things, because I'm subject for correction. Most of the monies which they are unable to account for them, they know very well that this one was presented by this department, so that we can start to look on that one. And before I complete, you see, myself, I was also touched on what was raised by the Auditor General. The Auditor General said the following. He raised the issue of operational inefficiencies, and also the issue of the leadership instability which is hindering the effectiveness of implementation of the program. And then also the limited secretariat capacity, and also the weak control over the procurement. This can help to guide us the task which we must give to them. Because if we just reject without giving them a direction, what do we mean? It's us who's supposed to go and to give them a direction that go back with the report, but go and correct this and this and this and this. So I concur myself with the thing which was raised by the Auditor General, that they must be corrected. Lastly, Chairperson, you see, I'm a little bit concerned with their organogram, with their structure. These are the things which we're supposed to analyze them with, to say, to the people responsible, whether it's the department or who's that when we say go back, they must go and rectify that one. They must fill those vacancies. Because even there, in their presentation, they indicated about the vacancies, that there is vacancies, some 2 people pass on, 1 resign, what. So that it can strengthen the functionality of this. As my honorable colleagues alluded to the new track, which is chaff, which is fire extinguisher. They didn't say anything about it, the remedy about that. So that is my take. That when we said we rejected it, but we must give them direction. So my suggestion to you, Chairperson, is to say that we are giving them so much time to come back. They must go and ratify 1, 2, 3, 1, 2, 3. So that when they think, like the issue of the regulations, if it's towards us, and then we relook on that one. But the thing of the finances and other things, yes, I agree, they must go back and rectify them. Get the culprits to come in account. Thank you, Chairperson.
Thank you very much, Honorable Sibande. Honorable members, you have made your comments in terms of this report. I will just allude the honorable members that this is just the briefing and the on the annual report. But I will occur with your decision for them as the department and the CDA to go back. They have listened to the issues that the honorable members have raised. And even if we must have a special committee meeting just to get a consolidated report from the department and the CDA. Because according to me, there are some miscommunication in terms of between the department and the CDA. But I must applaud the CDA for giving us a true report. It's incomplete, but what they have indicated to us is their challenges, and they did not sugarcoat this. They came forward and give us what is happening with the CDA. And as a select committee, we are responsible for oversight. And like the honorable members have indicated, this is really not a report that we must not adopt them or adopt this report. But there are too many gaps in the report. There are too many unclarities in the report, especially when we look at the finances in terms of the expenditure. Who was the ones who used that money? Because like the CDA have indicated, they only have virtual meetings. So as the chairperson, I make the ruling that the department as well as the CDA must go back and not change the information, just the information that we indicated that are missing. They must just include that into the report, and they must also bring along the new drug master plan, because they indicated that the challenges that was experienced by the members of the CDA is rectified in this new drug master plan. So they must also come with that one, as well as honorable members, the APP. of the CDA, so that we can see if the budget was aligned with the programs or the key priorities of the CDA. So, honorable members, the ruling is that they must go back, and we will indicate to them, and it will not be 2 months, Honorable Sibande. It will be 2 weeks. We will give them 2 weeks for them to, but we will indicate the date to them when they must come back to give that additional, not other information, just the information that we requested as a committee. So DG and chairperson of the CDA, as a select committee, we will request from you that you will go back, not rework, but put in the additional information that was requested by the honorable members. And then we through the secretariat of the committee, we will indicate to you when we will have the special committee meeting, so that we really can get into that information that was requested. DG, thank you very much. And we will also, if the minister can be part of that meeting, it will be a good thing, as well as the deputy minister. Thank you, DG. Anything, not just from your side as a department and from the CDA, just 2 minutes, DG, and the chairperson of the CDA, just 2 minutes, then we will release you.
Thank you very much, Chairperson, and also the members of the committee. We got the mandate in terms of what we are supposed to do. The only thing is that I think some of the information provided is not correct, because there's detail on which we have, how the money was spent, international trips that they are undertaken by them. Remember, this is 2024-25 financial year. It's not 25-26. It's that year. So the budget is within the department. It was spent for CDAs. There's detailed expenditure plan, expenditure, who does what, name, how many claims, how many. So it's very clear and straightforward.
We understand that. We understand that.
Yes. No.
Yes.
Thanks very much.
We understand that, DG. That is why we are requesting you to do it. Thank you, DG.
Thank you very much. Thank you very much. We appreciate the guidance.
Thank you very much, Honorable Chair and Honorable members and senior officials. I think the mandate is clear. We will really, expect the DSD, Department DG, to convene that meeting so that the DSD meets with the CDA and we really clarify all these issues. And just one last thing, Honorable Chair, in terms of our appointment letters by the minister, our term of office, maybe the DG can clarify, our term of office ends at the end of March, because we were here for 5 years. So if that can be clarified, but we are ready as the CDA to come back, even when the term is over, we'll come back and provide all the information that the honorable members have raised. And we really appreciate all the information, all the questions, and we will be able to respond. Thank you, Honorable Chair.
Thank you very much, Chairperson and DG. We will really appreciate it. But according to the CDAF, the minister have sent a letter to the speaker, but she did not send a letter to our chairperson of the NCOP indicating that the term will expire. But we will, DG, we will see to it because the interviews or nominations or how it's happening did not take place. So, but we will request this members of the CDA, if we have that meeting, that you come back to explain, because it's the annual report was in your term as a authority. So thank you very much to the DG and the delegation, as well as the members of the CDA. We release you. Thank you very much.
Thank you very much, Chair.
Thank you, Chair.
Thank you very much, Chairperson and members. Thank you. Hey.
Marcia, can you please flight report? Oh, the agenda.
Chairperson, sorry, would you like me to flight the agenda or the minutes?
Yes. The next on the agenda is the minutes.
Yes, Chairperson.
Okay, you can flight the minutes. Honorable members, we have received the minutes. So the minutes, let me just get that. Honorable minutes, it's the honorable members, it's the minutes of 11 March. Can we get a mover for the adoption of the minutes? Honorable Makwela, I see your hand is up, or is it a legacy hand?
No, I said it's the legacy and Chairperson. I really apologize.
Okay. Honorable Fanny.
Chair, my hand is up.
Okay, Honorable Fanny.
Yes, I'm moving for the adoption of the minutes, Chair, as presented, Chair.
Thank you very much. Can I get a seconder? Honorable Kennedy.
Chair, Honorable Mukweli, I'm now seconding.
Okay, thank you, Honorable Makwele. So the minutes is duly adopted. The next point on the agenda, I think, is other business.
Yes, Chairperson.
Marcia.
Yes, Chairperson, you're correct. It's other business.
So the first item under other business is the program of the oversight of Free State. You can proceed.
Thank you, Chair. Thank you, members. Chairperson, I just wanted to briefly just outline where we are in our logistics, especially seeing that we are embarking on this oversight next week. I think by now, all members have given the Assistant Masai Port Naklana the traveling details. So we are in the process of finalizing air travel, ground transport, and accommodation. We will be staying in the Bloemfontein area, Chair, at 2 nights and 3 days, roughly. And we have communicated with the province, so they are ready for us. I just need to get an address for the initial meeting by the Department of Health. They are also catering to our 2 luncheons. It will be a finger lunch, unfortunately, but that is all that I can provide generously, Chair. And yeah, Chairperson, so for all intents and purposes, our oversight should be finalized by the end of this week. I had also requested that the travel agents send out individual SMSs in terms of flights and accommodation, so members have their flight SMSs as well as the hotel vouchers, so that we don't have an incident where members are waiting at the hotels and they can't be checked in. But I must also note and inform members that because there is a 3-line whip, members are not able to fly on the Tuesday, which you probably know. So you have an early morning Wednesday flight, which means from the airport, we'll have to take you straight to the meeting. And And then we'll probably check in later in the day, Chairperson. Unfortunately, we won't be able to check members into the hotel when you land at the airport. We will proceed straight to the meeting. That's all from my side, Chairperson. I'm not sure if Tabile has anything else to add.
Tabile, anything else?
Good morning, Chair, members and colleagues. No, there's nothing else to add. Thank you.
Thank you, Honorable. Thank you, Honorable Dr. Tabile. Thank you, Tabile. Honorable members, that is the briefing in terms of the oversight program. I don't think there's anything from the honorable members, so we will move now to the next one. Is in terms of the a briefing on the international study tour to Switzerland.
Thank you, Chairperson. Chairperson, for the study tour to Switzerland, we have communicated with the South African Embassy in Bern. Our business will take us to Bern. So Bern is not close to an airport. In fact, we have to fly to Zurich, and from Zurich, we have to travel to Bern. So it's about an hour and a half traveling from Zurich Airport to Bern. Be that as it may, Chairperson, they are busy with planning our program. We did receive 1 or 2 or 3 confirmed dates. We were told that we will receive a program closer to next week, the end of the month. So we are waiting on the program to give dates to our events. We have commissioned flights, Chairperson, ground transport for those members that are doing the study tour. I have requested from members that do not have official passports to try and sort that out. I have been told that Honorable Feni and I think Ms. Mshlongo had gone to Home Affairs this week to apply for a passport. So as soon as I know that all members must please just send a message on the WhatsApp, maybe by next week, end of next week, just to inform me that everyone has an official passport, because we will need a Schengen visa and I would have to apply at the embassy for that. I'm not sure how long it could take. So I would like to have that documentation early enough. Usually the embassy also requires us to have CVs of every member of the committee traveling. So if members can prepare a short CV. So our trip is essentially from the 13th until the 16th. From the Monday to the Friday, but we fly in the Saturday the 11th. So we have 2 travel days, the Saturday and the Sunday we fly in. And then obviously we fly back the Saturday and the Sunday to land on the 18th. So that is the week of April the 13th, Chair. So that is my update for the study tour. I'm not sure if Tabile wants to add anything.
No, Marcel, you've covered everything. Thanks.
Thank you very much, Marcel. Honorable Adriaanse.
Just a quick question, if possible. The flight on the 11th of April, do we have any idea what time we will depart, if possible? And will you need copies of our passports for the Schengen visa or the passport itself? Because usually you need the passport itself. Thank you.
Thank you very much, Honorable Adriaanse. Honorable Makwele.
No, thanks very much, Chair. Let me also first by appreciating the department or the committee assistant with the arrangement so far. But I want to concur with Honorable Adriaanse that we need to get those logistical arrangements in time. But also maybe the committee assistants or the presenter, when they are referring to the CV, in fact, what actually are they looking for on the CV, so that they just said the brief CV, and also you must be telling us to say the time frame what is the deadline for us to submit, so that we don't want them to in future or when they are congested, they will start to say we requested this from members. Like now, as they've reported, if it is only 2 members who are looking for official transport. Yes, I'm happy that they are busy assisting them, but also with any information that they will need, they must tell us time frame, so that they mustn't tomorrow, if they don't meet their deadline, they'll say no, we requested this. So that's my submission. But up to so far, I should think so far so good. But let them just expatiate and be able to tell us that we want the CV before this time. We want everything sorted, everybody sorted before this time, so that maybe, Chair, if there will be a need for you to convene us in a meeting whereby they are able to deal with those logistics one by one. Because remember, we all know that when we were dealing with our local oversight, we had some issues that some of them we have to deal with them when we are on the ground. But now remember, when we in our countries, like when we are in your house, some of the things you can deal with them easily. But now, if you don't clean up your house timeously, when you are in another country, it is going to be difficult for you to deal with some of the issues. So I suggest that let's try to be meticulous when we are dealing with this overseas study tour. Thank you.
Thank you, Honorable Makwele. Marcel, over to you.
Thank you, Chairperson. Chairperson, as far as I can remember, the flight is in the evening. I think it's around about 6 p.m. flying from Johannesburg, because members are all, that is a common area for everyone. Chairperson, if you can remember, where I discussed that members would use their vouchers if they're coming from the parliamentary, if they're coming from their provinces to get to Johannesburg airport. So we'll be flying from Oliver Tambo. And then, Mr. Makwele, to answer your question, I would appreciate it if it is, they usually want a concise professional CV in terms of your work experience. What they do is, when we have these type of meetings with our counterparts, they would just like to see what your background is. So usually if we're meeting with the Department of Health or their ministry, it would be somebody that's heading that department. And they would just like to see who they are meeting with in terms of members, because all members have different sort of experiences, and everybody wasn't a member all their lives. So maybe they've had other careers, so they would like to know that sort of information, what your career was, that sort of like a very short, concise, maybe a 1-page or 2-page CV. That is what we need to submit. And if I could possibly have it by, look, next week is the oversight to the Free State. Maybe the week after, I will put something on the group. So let's give each other 2 weeks maybe to draft that. And if you can send that to me. And Mrs. Adrianza, sorry, I missed that one. I would need the official passport. That's why I was saying if we can just give the other members a chance to sort out their passports. And once I know they have it, I can then write to the embassy, and they would send me a note verbal requesting that the Swiss embassy assist us with the Schengen visa. So I will put all of that on the group, and then I'll also stipulate the deadlines. Thank you, Chair.
Thank you, Marcel. Honorable Sibande.
Chairperson, I'll start with my this oversight to Free State. I don't know, I received a communique that I must indicate which my house. The thing is that I'm subject for correction. When we're going to Free State next week, I will be from my province. That means that I must drive to OR Tambo Airport. And then also when we come back, the flight must drop me in OR Tambo so that I can get my transport. I won't be traveling from the village, which is Laporia Park. I mean, to and from, I'll be traveling from OR Tambo. And then secondly, I wanted to find out the clarity, because normally what used to trouble us when we travel abroad is the issue of the visa. Our country where we are going to, I don't know whether is it going to need a visa or not, because they must also find out that if it's going to need a visa, procedurally, what normally used to happen, like Michelle was correct in terms of the follow-ups which he did in the group, that people must indicate if you don't have any official passport. Normally, they need the details of the official passport in advance so that it can be sent to DERCO to communicate for us to the local embassy to do it for us as a group, so that the day when it comes, we mustn't suffer in terms of the visa if they are going to need a visa. That's what normally used to give a problem. Thank you, Chairperson.
Thank you, Honorable Sibande. Honorable Adrianse, is that on your end?
Yes, Honorable Chairperson, just a quick one.
Yes, please.
Okay. The one thing is, we won't be returning to Parliament after the oversight. So we must give our passports to Marcel either when we're coming back for the 3-line whip or at the Bloemfontein oversight. The second thing is I just want to remind again that I have to fly out on the Thursday evening to OR Tambo. That's it from me. Thank you, Honourable Finis.
Thank you, Honorable Adrianse. I think that is all. Marcel.
Yes, Chairperson. Like I said, I will collect all the passports when they are ready, whether we have to courier them to get them together, or if we will find a way to have the passports meet at one point, Chair, so I can submit them. And to answer Mr. Sibande's question, Mr. Sibande, I think the assistant might have spoken to you about your travel arrangements. I'm not sure. So you're not going to be at the Tuesday 3-line whip meeting. So you are flying Wednesday from Johannesburg. I'm just confirming that you're flying the Wednesday from Johannesburg. But otherwise, I'm covered, Chair. Thanks.
Thanks, Marcel. Honorable Sibande, are you not attending the 3-line?
I'll get a point. Let me correct that one then. That means when we leave during the week, it means that my transport I must be fetched at 51 Laboria Park. She must
Yes,
correct me.
Honorable Sibande, and when you come back, they must arrange transport for you to go home. Because
Exactly.
your transport won't be there. It's like me, I'm also traveling. I'm not flying from Bloemfontein to Kimberley because it's 160 k's to go, and I must get connecting flight. So they will also arrange transport for me to go home. Thank you, honorable members. I think Marcel have respond to the questions. And then, honorable members, I think this is the last item on the agenda. So I just want to thank the support staff for getting everything ready for us and being part of the meeting and assisting us as a committee. We really appreciate it. And then to the honorable members, thank you very much. You were very sweet and short this morning. Till now. Thank you very much, honorable members. This meeting stands adjourned.
Thank you, Chairperson. See you just now. Bye.
Bye. See you guys. Bye.
Lekker voorzitter.
Reg so. Agbare Sibande, bye.